As a financial planner who specifically serves families on the path to early retirement before age 60, one of the most common planning considerations and concerns is the cost of future health insurance. Those years between when they leave their employer's group health plan and when they enroll in Medicare at age 65. I used to think this topic of health coverage before Medicare only applied to clients who planned to retire before age 65. But then I read a report from the Employee Benefit Research Institute claiming that 70% of Americans are retiring before they're eligible for Medicare coverage. To me, this data point indicated that early retirement isn't necessarily voluntary, and that financial planners, regardless of niche, should be providing more personalized education and access to resources in this area. Before showing you how I review the Public Health Insurance Marketplace website to estimate coverage options and the premium tax credit, I'm going to briefly describe the 7 primary sources of health coverage available before Medicare. First, continued health coverage may be available through COBRA if the private employer has more than 20 employees. In most cases, employees are eligible for up to 18 months of continued coverage. Advantages of COBRA include keeping the same insurance provider and network, and not having to reset the deductible and out-of-pocket maximum within the same calendar year. The disadvantages include the higher premium cost, since the employee and employer portions are now combined, and also the limited coverage duration for typically only 1.5 years. Looking at the employee's previous year's Form W-2 in Box 12, Code DD shows us the combined cost of employer-sponsored health coverage. Some pay statements also include the employer-paid portion for the current year. Since continued health coverage through COBRA involves an additional administrative cost, we can multiply this combined premium by 102% to estimate the continued cost moving forward. Another option that may be available to those who terminate employment is retiree health coverage through their employer, usually requiring the retiree to meet a certain age and years of service, and often complemented by a pension plan with an immediate annuity requirement. If one spouse retires before the other, this qualifying event may open special enrollment to join their spouse's workplace plan. Since this option requires one spouse to continue working, it is rarely a permanent solution as a family. Similarly, some employees choose to retire from their full-time career and work for an employer who offers health coverage to part-time employees. University enrollment or group plans through professional associations may also be available, although they are not typically considered as permanent solutions. Option number 4 is coverage through healthcare sharing ministries. These are religious cooperatives to shoulder the cost of other members' medical expenses. This membership often requires the profession of religious beliefs, church attendance, and abstaining from recreational drug use. Pre-existing health conditions may apply, and treatment options may be limited. Although these ministries are not technically defined as insurance and cannot typically be combined with health savings accounts, HSAs, the coverage can be much less expensive than traditional health insurance options. Next is private insurance coverage, available through a local health insurance broker, agent, or insurance company. Medical underwriting and pre-existing conditions apply, and government-funded premium tax credits, which we'll look at in greater detail, cannot be applied outside of the health insurance marketplace. Moving to option 6, we'll discover when shopping on the healthcare marketplace website that households whose modified adjusted gross income falls below the federal poverty level for their given household size are not eligible for exchange subsidies, but they are eligible for state-specific Medicare and CHIP programs. Lastly, and where we will spend most of our time during this lesson, is the public health insurance marketplace, commonly referred to as the exchange, the ACA, Affordable Care Act, or Obamacare since 2010. The marketplace is not government insurance, but rather a matchmaker between consumers and insurers. All of these marketplace plans have some common features, including out-of-pocket maximums, no denial of pre-existing health conditions, and the availability of federal government subsidies in the form of refundable premium tax credits when household income falls between 100% and 400% the federal poverty level. As an added note, the American Rescue Plan Act of 2021 temporarily expanded eligibility by removing the 400% subsidy cliff, and it could be extended through 2025, but there's lots of tax and healthcare legislation up in the air right now. To review health coverage options through the public exchange, I always start by going to healthcare.gov/C-plans. There are 17 states plus Washington, D.C. that have their own specific marketplace websites, as linked here in your lesson attachment, but you can always start at healthcare.gov and it will guide you to the right place. To begin our search for marketplace plans, we'll enter the client's zip code. You can start with where they currently live, then also research other zip codes if they are considering relocating. Let's pretend the family lives in Portland, Oregon, and Multnomah County with zip code 97212. Before we can review and compare plan options, we need to enter data about the household, including marital status, tax dependents, including the covered children, and expected household income. So if you know the plan ID for their previous year's coverage to help compare other options, you can enter that here or simply skip ahead. So for this search, let's assume a family of 4, a husband and a wife ages 45 and 44, with 2 young children, 2 daughters ages 11 and 6. So we'll select you and other people for this household, even if they don't all need coverage. This is a married couple, so we'll select yes. This couple will claim both of their children as tax dependents, so yes, with 2 kiddos. So the husband is age 45, male, so no longer eligible for health coverage through his job, and not yet eligible for Medicare, but he is the parent of children under age 19, and we'll claim them as tax dependents, not pregnant and not a tobacco user, so we'll continue. So the wife is aged 44, female, also not eligible for health coverage through a job or Medicare, but she is also the parent of a child under 19, not pregnant in this case, and not a tobacco user. So now we'll enter the tax dependents, both children. The first daughter is age 11, female, and none of these selections. And the second daughter is age 6, female, and also none of these. So we'll confirm the household members and move on to expected income. Healthcare subsidies through the Refundable Premium Tax Credit, PTC, are available to households with income within a certain range, also based on the family size and where they live. So to calculate household income, we start with the expected adjusted gross income for the year, AGI, then we'll add tax-exempt interest, Social Security benefits, and foreign income, then add any anticipated income changes, including expected raises and other income sources. So I always start my search by assuming no subsidies, so I enter a very large number here, for example, $500,000. If receiving unemployment compensation, they may be eligible for additional savings and lower cost due to the American Rescue Plan. But for now, we'll say none of these people. When we click continue, we see that household income is too high to be eligible for a premium tax credit. Let's move on to view the plans at their full prices, and then we'll come back to the income adjustments. When we arrive on the list of available plans, rather than scrolling through dozens of them, you can see that there's 68 plans available. I'm going to start by adding filters. So we can filter by premium ranges, yearly deductibles, whether the plan qualifies as a high deductible health plan, HDHP, with eligibility for health savings account contributions, HSA, bronze, silver, and gold categories indicating the percentage of health cost paid by the insurance company after the deductible is met. So bronze is 60%, silver is 70%, gold is 80%, and platinum, although not seen on this search, is 90%. So the bronze plans have the lowest premiums and the highest cost when the care is needed, and vice versa. We can also filter by health plan types, EPO and PPO in this example. PPO offering 2 tiers, in-network and out-of-network coverage, while EPO is more restrictive, quote, exclusive to in-network providers only. If the family has a pre-existing relationship with a medical provider, you can search for the doctor's name or healthcare facility's name to ensure they remain in-network. And you can filter the same for prescription drugs to ensure they are also covered by the marketplace plan. Lastly, you can filter plans by plan ID, insurance company, and medical management program for specific needs such as weight management, back pain, heart disease, asthma, etc. So let's start with our filter by searching for bronze plans that are eligible for HSAs. One of the valuable characteristics of HSAs is, unlike IRAs, their contributions do not require earned income. The family can continue to contribute to an HSA in early retirement, continuing to build tax-free investments for qualified medical expenses. When we apply the filters for bronze high-deductible health plans, 7 plan options become available to review. Each plan shows the monthly premium, in this case without any premium tax credit applied, the yearly deductible, the out-of-pocket maximum, and copayment coinsurance. Since this plan's deductible and out-of-pocket maximum amounts are the same, that means the insurance company pays nothing until the family pays $13,800 for qualified health expenses, but then covers 100% through the rest of the calendar year. Navigating through the website, I preview 3 provider plans per coverage category, including the plan type, whether it is HSA eligible as a high-deductible health plan, the deductible and out-of-pocket maximum, and the estimated monthly and annual premiums with or without dependents. Before we estimate the premium tax credit based on various household income levels, it is helpful to see the full price plans. This helps the family mentally account for future non-discretionary cash flow needs and understand the difference between what they are currently paying as an employee versus what to expect when covered through the public marketplace plan. Once we understand the full plan prices, we can go back to the website to estimate the premium tax credit, PTC, based on household income. So if we click View Steps at the top of the page, and then click Edit next to Your Household Income, we can enter various amounts to estimate PTC eligibility and monthly amounts. So estimated income, we'll say, is $160,000. Go down to Continue. So we can see that there's an estimated credit of $190 per month, which is, take out my handy dandy calculator, equivalent to $2,280 per year with both dependents on the plan. So we can repeat that process with various income levels to visually educate families about the intentionality of taxable income and asset location in retirement. In this complete example, looking at the second line on the list, this family could be covered by the Pacific Source PPO High Deductible Health Plan, eligible for family HSA contributions, for a full annual price of $12,996. If they can maintain their desired lifestyle expenses while keeping household income at $100,000, the annual plan price is reduced by $7,968 down to a total of $5,028, which is $419 per month. Notice that if household income is too low, part or all of the family may qualify for Medicaid or CHIP through their specific state agency. Many financial planning clients have limited beliefs about the cost of future health insurance in retirement, but we can provide additional clarity and confidence by showing them which areas are in or out of their control. There are quantitative variables and trade-offs to consider when reviewing health coverage through the marketplace, including the prioritization of premium tax credits over aggressive Roth conversion strategies, other tax deductions or credits, tax loss or tax gain harvesting, portfolio rebalancing, financial aid considerations, and chronic health conditions. These lessons will continue to reiterate that we need to keep finance personal and measure twice, aligning dozens of quantitative financial variables with the family's unique values and desired outcomes.